This is Residents in a Room, an official podcast of the American Society of Anesthesiologists, where we go behind the scenes to explore the world from the point of view of anesthesiology residents.
Mentorship isn't just about having one person that leads you and shows you the correct path, but there's actually different people who are in part of your life to help you in different domains.
I am at that point where I take the disappointments pretty hard.
I think that resilience itself, at the core of it, is you realizing that you're enough.
Hello and welcome to Residents in a Room, the podcast for residents by residents. I'm your host for today's episode, Sabrina Muhanna. I'm a first-year anesthesia resident at the SUNY Downstate College of Medicine. Today, my fellow resident and I are going to talk to Dr. Christopher Fadumiye about how to go beyond simply surviving residency to thriving through residency. It's a tall order, but a worthy goal, so I'm looking forward to getting some useful tips. But before we get into it, let's meet my fellow resident, Dr. Bayless.
Hi, I'm Spencer Bayless. I'm a CA2 at the University of Arizona in Tucson, Arizona.
All right, so Dr. Fadumiye, you've heard a bit about us. Do you mind telling us a little bit about yourself?
Absolutely. First off, thank you guys for having me here today. This is a very great opportunity to talk to you guys, and I take a lot of pride in being here. My name is Dr. Christopher Fadumiye. I'm an associate professor of anesthesiology at the Medical College of Wisconsin. I'm also a regional anesthesia fellowship trained provider. I take pride in mentoring. I take pride in teaching medical students, residents, and fellows, and I'm happy to be here.
All right. Thank you for that. We're excited to have you here. Thank you for taking the time out of your day. I'm sure, you have a very busy schedule, but we really, really appreciate it. So to start off, I'm interested in what thriving means to you. What do you think is important when it comes to thriving in residency versus just surviving?
I think the key word there is the differentiation between thriving and surviving. When I think about residents who are just surviving, a few things come to mind. There's always that sense of just going on to the next elective, just staying under the radar, just graduating without raising any alarm bells, and just getting by. And when you juxtapose that to residents who are actually thriving, the key difference here is you find individuals who feel supported, either by their peers, or by the institution, or by the people they surround themselves with as family. So I think, in essence, those who thrive are those who feel that they are being supported and they have a direction in terms of where they're going with their career.
Dr. Fadumiye, if I'm hearing you correctly, it sounds like what you're saying is that residents who kind of get into this survival mode can be a little more withdrawn professionally and in their personal life. And I'm wondering if, as a mentor, is there any kind of early warning signs that you see when people start slipping into that withdrawn survival mode?
Yeah, there are a few things you start to notice. One of the things I pay attention to is how are they interacting with their peers? How are they interacting with their faculty? And most importantly, how are they performing when it comes to the metrics we use to gauge resident competency? So a lot of red flags tend to turn up early. And I think that institutions who have done a good job at addressing those red flags early can help potential residents who are just surviving.
Yeah, I definitely think that a good support system is such a game changer, especially, I'm transitioning into residency. I'm halfway into intern year, but I definitely think that, I'm very thankful for my support system. And I think that's a big reason why I feel like I am thriving. I'm happy so far. So thanks for pointing out the things that we should look for when we're going into survival mode rather than thriving. Our next question is, do you have any advice on time management? I mean, anesthesiology is a very demanding career when it comes to time. And I think all of us as medical professionals sometimes have issues with managing time at work versus managing time at home. So Do you have any thoughts or resources on how we can make a good work-life balance, but still feel like we're getting a hold on our time management?
Yeah, absolutely. One of the things I recall a good mentor of mine telling me early on is structure breeds function. When you have a structure around you, that you have a level of accountability towards that structure, you're more or less going to be more functional versus if you don't have a sense of structure around you. And so if you have a sense of, okay, I'm in residency, I have to prepare for my ITs, I have to study for my basics, I have to think about the case I have to deal with tomorrow and call my attendant the night before. I also have a family at home. I have to take care of my kids. I have to call my mom who was sick. That's a lot of things to like try to juggle. But if you can create some level of structure, and that will deal into just being able to manage your time and paying attention to what you need to do in the moment, and also having a level of accountability towards that structure that you're trying to create for yourself, you're more likely to be more successful. So again, I counsel residents when there's a lot coming at you at the stage of your training, at the stage of your career, and if you get lost with the multitudes of things that you have to deal with without finding a way to just sit down and find some level of structure with your time management, with your wellness, with the things that you can't even get to, you're more likely to be better off versus just going with the wind and just doing things as they come.
I'm curious if you can maybe get a little more granular on what that structure can actually look like and maybe what elements of an effective structure are most important. Because as I'm hearing you say that, I'm also recognizing in my own life that structure is very important, but residency is always very chaotic at times too. And so there's a certain level of flexibility that's needed as well.
Yeah, absolutely. And yes, I can definitely get a little bit more granular. So every resident at the different stage of the training is going to require a different level of structure because you're dealing with different things. As an intern, you're basically coming into medicine from medical school. As a CA1, it's your first exposure to anesthesia. As a CA2, you're probably thinking about, do I apply for a fellowship? Do I get a job? And as a CA3,
Yeah.
it's a different thing that you're potentially dealing with. And what comes with that is also life. Some have families, some have things that they're dealing with. And a good way that I say that at each different level of your training to build some level of structure is to find someone, an ally who you can be accountable to. It could be a friend in a different residency program. It could be a peer in your residency class. And what brings you guys together is the commonality of the challenges that you're facing. If I have an ally in my CA1 class who also has to study for the IT, who also has to basically get up in the morning and go set up their room and talk to an attendant the night before, you have an ally who is facing the same challenges. More so, I mean, the challenges at home might be a little different. And what comes with that is just the camaraderie of being able to say, you know what, we had to study. Oh, did you meet this deadline? And in a way, it builds that structure for you. And going back to the earlier question of surviving versus thriving, the essential message is it's not okay to be an island. And if you have the surrounding around you with the right people who have your interest at heart, be it the people in your peers or the residency program or the administrative staff, then you're more likely to have a more tailored structure for your level. As a CA2, the same thing applies. Like you have peers in the residency program or peers elsewhere who are basically facing the same challenges. And it's easier to find some granular structure where you have ours.
It sounds like what I'm taking away from what you're saying is that you, to use another term, need this structure or a foundation to fall back on when things do get chaotic, and you do have to have some flexibility. And that foundation can come in the form of mentors, but also colleagues and family members at home.
Correct. And honestly, to be honest, things will get chaotic. Like, I think the notion that coming into residency after medical school, it's the triumph of that is big. But I think what we don't really tell trainees is you're coming into a specialty that you've never had any form of experience. I mean, for the most part, you've never had any form of experience with anesthesia. And as with anything that's new, it's going to be challenging. And so that there's an expectation that there will be ups and downs. And the honest truth about that is that doesn't end. Even as an attendant, you're still going to have things that challenge you. And I think coming in with the mindset of, oh yeah, I just graduated from medical school, I'm about to start residency. A lot of times people are met with the disappointment of how challenging things can be. But I think embracing it and having people around you, the foundation and the community, can help build that structure.
That is wonderful. I am curious if you think that there's any common strategies you see that residents often try that lead them to not doing very well in terms of time management.
One of the phrases I say a lot is closed mouths don't get fed. And the residents who don't open up about their challenges, who have a sense of, oh, I've done it alone all my life. I studied for step one by myself. I've always been the top of my class. I'm smart enough to do this by myself, are the ones who really, really struggle. On the other hand, the ones who see asking for help as a sign of not being weak, but as a sign of strength, are the ones who actually do well. So again, the closed resident, the one who doesn't communicate the need for help, the ones who basically do it on their own, are the ones who suffer.
I think that it's a common feeling for residents to be at a very, very low point. Were there any moments where you questioned whether residency or even medicine was worth it, given that maybe you weren't able to go to like family events or not able to spend as much time with your children if you have children? And if you did feel like that, how did you work through it?
Yes, there's been plenty of times like that during residency, and I hate to break the news to you, there'll be many more times like that.
Yeah.
I'm so excited.
Yay.
But it's an honest truth though, and I think that you learn from all of these experiences, and you learn to pivot and make the best adjustment for the best situation that you're faced with in that time. So for me, I recall being a resident and my grandmom had just passed away and I was not able to be present for her. My dad also was dealing with some health issues. He was diagnosed with prostate cancer and I wasn't present for him. I had taken step 3 a little later, so I had to take it during my CA 1 year while I was also trying to prep for my in-training exam. So there was a lot of stuff going on,
Yeah.
as you can imagine. So what I do recall during that time was I had to really care for myself first, and I had to really be present for myself to be able to go through and take the necessary exams, and they also be present for my family. And so
Yeah.
I think at the end of the day, if you're not well enough to take care of yourself, it's harder for you to be able to stand up for your family or your friends or the people you really care about. And there's that saying about self-care is never selfish. It truly isn't. Like you really had to look out for yourself first. And until I started doing that, meaning, hey, I got to pass this exam, I had to take it, I had to be healthy, then I can at least go say hi to my dad. But if I'm not able to be present and be well, I can't even show up for my dad. So that's what I took away from that experience in terms of just wellness and just being able to accommodate the people I care about by accommodating myself first.
Yeah, that makes sense. I mean, something that I've seen in myself during medical school and in my brief time in residency is sometimes it can feel like a spiral. You just kind of focus on all the negatives and then you're like, oh, everything in my life is terrible. But then, like you said, you have to remind yourself, I am here because I chose to be here and I'm blessed to have this career. I'm blessed to be healthy enough to have this career. So it's just kind of like giving yourself little reminders that I think are very helpful. And I guess that helped you get through those times.
Also, to add to that, I think when it comes to just wellness and just taking care of oneself, there's an acronym I learned from another mentor of mine, and it's SALF, SLAF. And S stands for sleep, L stands for light, A stands for activity, and S for food. And this individual told me during that time that you have to get enough sleep. You have to get outside, you have to exercise, and you have to eat right. And that's the basic fundamentals of taking care of yourself.
Hmm.
If you don't have enough sleep, you're not going to be able to study well. If you're not healthy with your physical activity, you're not going to be able to concentrate or to take care of someone else, more or less a patient or your family. So I think when it comes to just being selfish about one's self-care, I strongly believe that it's necessary to be able to do that for yourself so you can do better for others as well.
I think hearing you say that, something that pops into my mind is honestly a little bit of anxiety about all that, because I think as residents, we're all high achievers to some degree. And I think about all those things, and my mind immediately goes to all the times that I'm not getting sleep, or I'm not going outside often, having good activity, or eating good food. And hearing you kind of name that and bring it to the forefront of the conversation also reminds me that it's okay to not be doing those things 100% well all the time.
That is true. And so again, at this stage of your training, 99% of us are all high achievers. And one of the things that I think is a fundamental trait of high achievers is that the spirit of resilience, the power or the ability to return or to bounce back or to remember to come back from a place of stress to a place of just being okay. So yes, you're not going to get 8 hours of sleep in residency. Yes, you might not be able to go outside every day of the week, but you are going to remember to do it when you can. And I think a little by little kind of makes a lot in the long run.
Absolutely. And bringing that up, I'm wondering if you could maybe speak a little more on what role you think that resilience plays in ensuring that we're thriving during residency and not getting into just a survival mode.
Yeah, so I think that resilience itself, at the core of it, is you realizing that you're enough even when you cannot sleep 8 hours or eat healthy every single day, but you know that you can fall back on doing those things when you can, especially with the nature of residency where it's so much designed for you to give a lot of yourself. You're giving a lot of yourself to learning the craft, and you're giving a lot of yourself to being away from your family. And so at the heart of it, I think resilience plays a pivotal role. And I think also, in addition to the spirit of resilience that's present in the process of thriving, is also just realizing, asking for help, taking advantage of the help, and knowing what the help is. And again, help in every institution is going to be different. And I think that being resilient is also looking for what it looks like at the very institution you guys are present at. And just knowing that it's okay to just say, you know what, I need help. I think that itself, it's a core aspect of being resilient.
One thing I'm wondering is, I mean, residency is temporary, but attending life is forever. So, what advice would you give yourself as a CA3 transitioning into attending life?
As you asked that question, I'm smiling because I can think back to that point in my timeline, and I remember what I had to go through then and where I am now. So I'll just go back and tell a quick story of when I was finishing my residency. I transitioned into a fellowship at the University of Wisconsin in Madison, and it was a fellowship that came with an instructor role. So I was able to be a fellow and also earn extra money by being a staff enroller. What I did not know at that point was I was jumping tax brackets. And so at some point I got a letter from the IRS saying I owed thousands of dollars. And
Oh gosh.
I was so surprised. I'm like, okay, this is not okay. Well, I've always paid my taxes. I've always done things right. And so I think what I say all of that to say what I wish I had known then is just the little financial details that no one tells us. And some places are doing a better job of informing their trainees and residents about just the things you have to worry about, jumping tax brackets and having to owe more taxes, setting up a life insurance, a Roth IRA, and just things of that nature that you really don't talk about because you're buried in Barish and Baby Miller or Miller because you're trying to do well in residency. So if I could go back, that's one thing I wish I would have at least been more educated about. And the second thing I see it a lot now in a lot of the C3s transitioning that I mentor is because a lot of times you're finishing training and you're going into a job or fellowship or whatever the case is, and there's that fear of, am I enough? I don't have an attendant supervising or over and over me to make sure I don't make any mistake. This is all on me now. And I would like to tell my younger self, and even the C3s coming out now, that trust in the training that you've received. Trust yourself that you've done the work to get you here. Trust that the institution and the ASA are seeing you worthy enough to be a diplomat of the American Society of Anesthesiologists. So trust your training and know that you're enough. So those are the two big things I was saying in terms of just what I would tell myself back then.
Yeah, I definitely think we have to circle back on the financial stuff, maybe in another episode, because definitely need need the advice.
Happy to share nuggets with you.
How do you day to day as a resident maybe build that trust for yourself as you're talking about?
So again, this ties all in back to the big conversation of the day, thriving, right? So say you're in a pathway of a resident was thriving. You're going to have a mentor. You're going to have people who give you feedback. You're going to have people who will tell you the hard truths, things you don't want to hear. And with that, you're going to get better. And your level of confidence hopefully starts to go up. And the more confident and comfortable you are in what you're doing, the more likely you're going to go out there and see the cases you've done before 1,000 times and feel comfortable doing it. Now, if you juxtapose that to a resident who is just surviving, you don't have a mentor, you don't have people telling you the hard truths. No one is giving you feedback. You're very unsure. You're just getting by. You're trying to stay out of trouble. You're flying under the radar. You're really just saying, you know what? I'm here so I can get out and get a diploma and just go get a job. When you get out there, you're going to face challenges. You're going to see things you are not comfortable with, things you haven't done before. But because you haven't built the credit of saying, you know what, I haven't seen this before. Let me call my mentor or my senior resident to ask, hey, what would you do? You're not going to have the confidence in yourself. So I think the way you build that is to make sure you're thriving, to be in a situation where you're not just surviving. And if that's the case, then I strongly believe you're going to be fine.
Yeah, and as I'm hearing you say this, I'm immediately going back to what you were saying in the beginning about structure. And what I'm hearing from the resident's perspective is that throughout residency, it's very important that you not only find a structure, but you continually build it and improve it.
And guess what? It's a lifelong process. And never hands after residency. It's something you have to keep doing.
I'm wondering, because you're saying your confidence in yourself depends on how you thrive during residency, but when did you first feel like you had control of your OR, that you just felt comfortable in your abilities to deliver anesthesia to patients in your residency, or even, maybe after residency?
So that's a relevant question. I'm thinking back. I think for me, it came in stages. Certain things I was comfortable doing and certain things I wasn't comfortable doing. But I go back to just the mindset of knowing the difference and the mindset of pointing yourself in the right direction to say, you know what, I need to ask for help. And that goes back to what I always tell my CA3 residents. You guys are at a stage where you're almost done with training. You've seen a lot of different things in the specialty of anesthesiology, and there's that sense of confidence, which is good, which is what we want. But that confidence can sometimes bleed over to overconfidence or a sense of cockiness, which can, in a way, hurt the person and sometimes the patient. Because when you're overconfident, when you lead with just your ego, you don't have the judgment to say, you know what, I need to ask for help. I haven't placed a double lumen tube in 7-8 months. I really don't remember how to do it. But I can do it because I just graduated from so-and-so university. And so, again, I think for me, the confidence came in sports. And I think the fundamental difference, though, was I always knew my limitations. And I always said, you know what, I can't do this. I have to ask someone to help me. And the more I did that, the more confident I got in the things I couldn't do. And there'll be also be certain things where I still don't know how to do, and I still go back to the same basic fundamental. Go ask for help and get the help and get better at doing it, and then get confident during the process. All right, so you guys have asked me a lot of very relevant questions, and I hope you guys have been able to take a lot from this. I would like to ask you guys a few questions as well, just to see what you guys are thinking and just get your thoughts. Is that okay?
Yeah, certainly.
All right. So we've talked about challenges and we've talked about just how there's always going to be ups and downs in any stage of your training, medical school, residency, even being an attending, there's always ups and downs. How do you guys deal with the disappointments that come with the downs?
I think for me, early on in training, I took disappointments very personally and as if I was failing. But as I've gone through residency and spent a little more time sitting with those, what I thought were failures, I've realized that it's really just kind of setbacks that fall into two categories. I think most of the time it's either things that I could have influenced and controlled or things that I couldn't have controlled. And being able to separate those now has allowed me to not view them as failures or disappointments, but view them more as lessons in my mind, thinking, how could I have controlled what was able to be controlled to have a better outcome?
Yeah, I think because I'm early on in my training, I am at that point where I take the disappointments pretty hard. There's patients that I had in my first month of residency that I still think about. And kind of going off of what Dr. Bayless said was I do take them as lessons. I'm like, okay, this patient had this outcome. Maybe next time I'll just be a little bit more weary of, my physical exam, like do a more thorough physical exam. But I also think sometimes it's hard, maybe because I'm an intern, to know when you are doing too much for these patients just because you had a failure in the past. And I think that's something that even in medical school I struggled with, but I try to keep the patients that whatever bad outcomes or that I have lost in the back of my mind to deliver better patient care. But I think, like I said, the balance between doing too much is difficult.
All right. So with that in mind, do you guys have a view on mentorship when it comes to dealing with the disappointments and the setbacks? And if you do have mentors, what role have they played in shaping your career so far?
I've been fortunate to build a good, as you would say, structure of mentors. And I think there was a big shift for me going from CA1 into now CA2, where I'm realizing that mentorship isn't just about having one person that leads you and shows you the correct path. I'm doing correct in quotes because correct is whatever you mean it to be. But there's actually different people who are in part of your life to help you in different domains. So I have mentors that help me with things like clinical judgment. Other mentors have helped me a lot with planning my career path and trajectory. And other mentors have helped me a lot with balancing personal life and work life and things like that. And that's helped me get the most out of each relationship, I think.
Yeah, I agree. I think my mentors all throughout like my medical career, they did a great job at teaching me how to do work-life balance, but also help me when I'm overthinking. I think as professionals, we are always thinking of every possible scenario that could happen in the world, but it's important to have someone to help you dial back and understand what is feasible and what's not feasible. So I think mentors really, without them, I probably would be a very anxious ball all the time. But I feel because I have a really good support system and great mentors, it helps me, calm down and know what to do and what not to do.
Great. Lastly, is there anything we at the AAC can do to help you thrive that we're not already currently doing?
I don't know about not already currently doing, but one thing that I think would help would be something we've touched on a little bit is the transition going from resident to attending can be anxiety inducing. It involves things like we talked about, like finances, contract literacy, decision making on your first job that sets you up for your second job, and balancing maybe a better schedule versus an area you want to live with your family. And it's a lot of moving pieces that can bring on stress and anxiety. And so even small guidances in those areas, like what you brought up with your story about the IRS earlier, is helpful to hear, I think.
Yeah, I definitely think the ASA already does a really great job at giving us so many resources to network and to prepare for certain things. But honestly, if there was anything to work on, it would be also for people who are trying to pursue fellowships. I think there was a recent podcast by the ASA president about residents wanting to pursue fellowship versus just going to private practice. And I don't think there's enough information on what it means to actually go through with fellowship and how that can change the trajectory of your career. So there's a couple of things, but I think focusing more on that would be helpful.
Thank you. This has been really fun, guys. It's been a pleasure talking to you both, and I hope this was helpful to you guys as well.
Very helpful.
This was a great conversation. Dr. Fadumiye, thank you so much for sharing your knowledge. And we're really excited for another conversation we'll have with you that we'll post in March about having hard conversations with patients and their families. So, listeners, you'll want to come back for more Residents in a Room, the podcast for residents by residents soon.
Hello, ASA. I'm Dr. Patrick Guillaume, your ASA president, and this is the Monday Morning Minute, with recent highlights from the Monday Morning Outreach. First up, anesthesiologists are paid by Medicare less than 1/3 of our fair market value. ASA is working with Congress to get an annual inflation adjuster, which would set Medicare on a better path forward. Next, I attended the AMA State Advocacy Summit in January. We will leverage our relationships with legislators and within the House of Medicine to drive our agenda. Last, ASA is accepting applications until February 9th for the Resident Scholar Program in Political Affairs and until February 28th for the Anesthesia Quality Institute Resident Research Rotation. These are funded and residency credit rotations. Well, that's enough for now. Thanks for listening, and I hope you'll follow us on your favorite social media channels and check out my weekly Monday Morning Outreach.
For more detailed and timely information, don't miss Dr. Guillaume's Monday Morning Outreach email delivered exclusively to ASA members' inboxes every Monday at 5 a.m. Eastern. Anesthesiologists are detail-oriented, vigilant, hands-on, skillful with procedures, calm in stressful scenarios, and communicate well with patients, surgeons, nurses, and multidisciplinary healthcare teams. Becoming an anesthesiologist is challenging but rewarding. See how you can build a successful career in this exciting field. Learn more at asahq.org/roadmap. Join us for Residents in a Room, where we'll share timely info, advice, and resources designed to help residents succeed in residency and beyond. Find us wherever you get your podcasts or visit asahq.org/podcasts for more.